Let's switch from focusing on mental health and your patients to a focus on managing your own mental health. Caring for others, particularly those with mental health conditions, can be difficult. As a CNA, you are responsible for much of the daily support and care of patients, and you may find yourself physically, mentally, and emotionally drained. It is important that you take care of your own mental health so that you can care for others. Just like your patients, you and your coworkers will have different physical and emotional needs. Try not to compare your reactions to patients with those of your coworkers. Your physical, mental, and emotional health are unique to you and heavily influence how you react to your patients. Take time to evaluate your safety, including your physical safety, and report any misconduct to a supervisor. If you ever feel physically, mentally, or emotionally abused by a patient, you should immediately report the situation to your supervisor. Caregiving is a difficult job, and you may find yourself saying something like, "I can't take time for me. That would be selfish." Taking some time to take care of yourself is not selfish. It makes you a better caregiver. Remember the speech given about oxygen masks on airplanes. You cannot help others until you put your own mask on. The same is true for caregiving. You are valued as a healthcare professional, friend, and family member. Your mental health matters, and you need to take time to maintain your own mental health. This may mean that sometimes you need to take a step back from the situation, reach out to a friend or mental health provider for advice, or regularly participate in activities that reduce your stress level. Keep in mind that some level of stress is beneficial. Stress is one of the things that pushes us to do more and do it better, but we need to keep that stress at a manageable level. When you take care of yourself, you are at your best to take care of others.
Outside of work, I like sitting home. That's my go-to. I like having cookouts. I like hanging around family and friends. That's the most important thing in the world. Getting around your families and friends, sweating a little bit, dancing, snapping your fingers. That's my go-to. Or I can sit in the house with my children. That's the most important thing to me, is spending time with my children, because once again, they're not little long. So I have a 2-year-old, a 4-year-old, and a 15-year-old. So I get a little bit of both worlds. Yeah.
We often hear the word burnout when we talk about stress, especially stress in the workplace. But burnout is more than stress. It is chronic or ongoing work-related stress that has not been successfully managed. Burnout has been described as feelings of exhaustion or of energy depletion. Some people may say that their jobs are sucking the life out of them. You have probably felt like your job is sucking the life out of you some days, but burnout happens when this feeling continues for a long period of time. Burnout can be confused or mistaken for other mental health conditions, including depression and anxiety. If you experience any of these feelings, seek out a trusted mental health professional or mentor. Burnout may not be a problem that you can solve on your own. Some research conducted by the American Medical Association suggests that burnout must be fixed at the work environment level rather than on an individual level. If you are feeling burnt out, there's a good possibility some of your coworkers are as well. Burnout is a problem for you as a CNA because it is associated with mentally distancing oneself from one's work or developing persistent negative and cynical feelings towards one's job. Burnout can therefore lead to lower job performance, potential life-threatening mistakes, and poorer overall health care for patients. As a CNA, you have an extremely difficult job and face a higher risk for burnout. It is important that you recognize when and if these symptoms arise and seek help to reverse them.
Learning how to say no, that has been, a big thing, because you want to help out, every person or in every way you can, but you have to help yourself first to be able to help other people. And learning how to say no to that extra shift or that extra load of work has really helped me out a lot. And taking a step back, because outside of working on the floor, I work here in the kitchen as well. So I had to step back last month, and it's been good. I actually enjoy my days off now.
One specific type of burnout is compassion fatigue. Compassion fatigue describes the physical, emotional, and psychological impact of helping others. As a CNA, you are at risk for developing compassion fatigue because you likely take on some of the emotions of your patients. In many cases, this is a good thing because it makes you an empathetic caregiver, but over time, you can begin to feel overwhelmed. This can result in you becoming numb to the needs of your patient and can reduce your ability to cope with the demands of work and life. It is important for you to take care of yourself so you can successfully help your patients. What does compassion fatigue look like in practice? Compassion fatigue looks different for each person, but common symptoms include feeling helpless to help patients, developing an emotional detachment or numbness, loss of interest in previously enjoyable activities, both in and out of work, feeling overwhelmed or exhausted when thinking about work-related activities, difficulty concentrating on work-related topics, neglecting self-care activities, including personal hygiene and exercise, substance use, including substance consumption, difficulty sleeping, including difficulty falling asleep and experiencing nightmares, increased feelings of sadness, anger, and anxiety, changes to physical health, including increased gastrointestinal issues and headaches. Since burnout and compassion fatigue can have such an impact on you, it is important that you come up with a prevention plan. The following items have been found to reduce burnout and compassion fatigue in healthcare professionals. Remember, you may need to adjust this list to meet your individual needs, but this is a good place to start. Let your personal values guide your daily schedule. Make sure that your daily activities comply with your individual values and spend time in those activities that lift you up and adhere to those values. Consider your work from a new perspective. Many people can get caught up in the mechanics of their jobs and forget the larger purpose. As a CNA, you provide care to people who need your help to complete their daily activities of living. You fill a unique role, and your contributions are needed and valued. Look for meaning in other areas of your life. If your work is not fulfilling, consider other areas of life where you can find fulfillment. This includes finding meaning in your personal or social life. Seek guidance and support from trained professionals. This can include mental health professionals, mentors, and career counselors, among others. Keep the present in perspective. Consider your contributions to your patients and your work today. And don't forget to schedule time to engage in activities you love. When your time is limited, consider the activities you can realistically participate in with limited time. These activities might include a walk in nature, reading a book, watching a funny TV show, or spending time with friends and family. Remember this image showing the elements of well-being? Mental health impacts all 7 elements of well-being. Because mental health impacts all the elements, let's refresh yourself on all the elements of well-being. The elements included physical, emotional, intellectual, social, environmental, financial, and occupational well-being. Each of these elements needs to be addressed to achieve overall well-being. There are a number of recommendations for maintaining or improving well-being in each category. Physical well-being can be improved by participating in any physical activity. This can be strenuous or gentle, but some level of movement can improve mental health. Journaling gives you the chance to process complex emotions privately and on your own time. Intellectual well-being is improved anytime you learn something new or engage in an activity that makes you think. This might include learning to cook a new recipe, playing a board game, or reading a book. Social well-being includes interactions between you and others. Think about ways that your interactions with others boost your sense of happiness. Activities like getting coffee with a friend, taking a walk with a neighbor, or spending time with family can improve your social well-being. Environmental well-being refers to your surroundings. Consider how you feel in your home. Do you feel calm? Is this a place where you can reflect and think? You may want to reserve one corner of your home for quiet reflection and mindfulness. Financial and occupational well-being initially seem unrelated, but both of these contribute to maintaining mental health when approached correctly. These two elements will be specific to your situation, but are worthy of thought. Sometimes you or someone you know has done everything they can to improve or maintain their mental health, and they require additional services. Mental health services are available in Georgia and elsewhere. Some are covered by insurance, others require out-of-pocket payment. The phone numbers listed are warm lines, or phone lines staffed by living people that you can call in times of crisis or for additional services. These phone numbers and websites are also listed in the supplemental materials. You make a big difference in the lives of your patients, coworkers, and family. Recognizing your own mental health needs allows you to care for others. Your mental health matters.